And you might have heard of antibody treatments for COVID-19, but really, how often are they done and who is even eligible to get one? Well, it seems it may soon be a lot harder to find it here in the United States, and that's because the FDA recently announced the U.S. government will stop the distribution of one of the popular treatments. Our Katya Stepovic spoke with a local expert to break it down, why that is at least, and she also has a look at how effective these types of treatments are and who can get it.
Bamlanivimab, or BAM, is an antibody that has been used to treat COVID-19 or SARS-CoV-2. The FDA issued an emergency use authorization for the treatment back in early November.
It's a specific protein that locks onto COVID-19. It's monoclonal because it's one protein, where when the human immune system generates an immune response, it's lots of different antibodies, or polyclonal.
Daneil Reed, family practice doctor at Primary Health, says the sources that Primary uses to access BAM are St. Luke's, St. Alphonsus, and Valor Health. And according to St. Luke's, they are seeing success from the treatment. An article on St. Luke's blog reads in part, in the 5 first weeks, it was given to 159 patients averaging 68 years of age. Approximately 80 hospitalizations were prevented, with only 13 of 159 experiencing worsening symptoms.
Limited resources available in the Treasure Valley, limited national resources. It's not the solution for all patients.
Not only is supply limited, but there are extremely strict requirements on who is actually eligible to receive treatment.
It's for patients 12 and older, high risk, and these would be conditions such as chronic renal failure, kidney failure, diabetes. That narrow approval that we have for this medication, the supply hasn't been the dominant issue.
Reed says patients at high risk must be early on in their infection, meaning they cannot be seriously ill or in need of hospitalization.
We, of course, follow up all of those patients carefully, mostly through telehealth, and in all the patients we've treated, we've had good outcomes.
If it is still working to treat SARS-CoV-2, why not just keep it around?
A single protein looking for a single location on the virus. When you've got variants, which are in essence mutations, monoclonal antibodies can lose their effectiveness, and their effectiveness is not being demonstrated on some of the variants.
Reed adds that there are likely a lot more cases of variants in Idaho than are being reported. So, like everything during this pandemic, Reed says antibody treatments are going to need some refining. Now, Idaho has received over 4,000 vials of BAM, so providers can continue to use their current allotments. But Shira, once they run out, they will not be getting new shipments from the federal government.
Good to know. Thank you, Katya. Have a good night.